Hello and welcome to 1 in 75. My name is Alicia and I'm an ovarian cancer survivor, and I'm just making a series of videos to help the newly diagnosed, whether it be ovarian cancer, breast cancer, or any other type of cancer, just to kind of give you an idea of what you can expect as you go from getting your diagnosis to meeting your oncologist, your first treatment, and beyond. Want to give you some positivity and some hope and kind of take some of the fear and scariness out of the whole process. So we did an earlier video about having your port implanted into the right side of your chest where you can receive your chemotherapy treatment. I want to talk a little bit about the port. Now, when you go to the treatment center for your treatment for your chemotherapy, you're going to go see the ladies back in the lab and they're going to do a blood draw, and they're not going to take it out of your arm. They're going to take it out of your port. So here are some things that you should know. First of all, relax. I know that thinking about having the port access the first time can be a very scary concept. If you've looked up anything on Google or on YouTube, you see this really big long needle and it's scary, right? It's not. You're going to be amazed at how much better this is than getting an IV in your arm. Now, discuss with your primary care doctor or your oncologist and get a prescription for something called EMLA cream, E-M-L-A cream. It is a lidocaine prilocaine cream that you can put over the area where your port will be accessed, and that way you're not going to feel a thing. It is a miracle. I don't know why they don't use it more often. So make sure you get the EMLA cream. It is by prescription only. It will be a lifesaver, I promise you. Now, what you want to do with that EMLA cream is you don't want to just tuck it in your purse or in your chemo bag, go off for your treatment, and then right before you get called back, put it on. No, no, no. What you want to do is you want to take a nice little dollop of the cream, put it on your fingers, rub it all the way around where that port is going to be, then get yourself some press and seal cling wrap. Take a nice square of it and put it over your skin. That's going to keep that medication up against your skin, and it's going to keep it from soaking into your clothing, which it's not going to do any good there. You want it fully in contact with your skin. And when you do that, you're able to go about doing some tasks before you go to your appointment, and you don't have to worry about it getting soaked up by your clothing. I would recommend doing that 20 to 30 minutes before your appointment. That way it's all nice and numb and you are set to go. So make sure you get the EMLA cream. When you get called back to get your blood taken, you're going to sit in a really nice elevated chair. It's almost kind of like a dentist chair. It's very comfortable. Your feet are just nice and relaxed. You're going to lean back a little bit, and you will probably have 1 to 2 lab technicians that will get everything ready for you. It again almost feels like a little medical surgical procedure. It can be overwhelming. It can be a little scary, but don't be scared. They will clean this area thoroughly. Now remember, this tube from the port is going down into one of your main arteries. You don't want infection. They are going to thoroughly clean that area just as if it were a surgical procedure. So just be prepared for that and don't let that overwhelm you. Before they access, you can ask to look at the implements that they'll be using so you can become familiar with them. If you have a fear of needles, I'd suggest not doing that. That needle can be a little bit, what's the word I'm looking for? This is a result of chemo. It can just be daunting. Let's just say that. Turn your head. Now, when they access it, you're going to want to turn your head anyways, because you want this tube to not be pinched or impeded in any way. It's easiest if you have your head turned. A, you're not looking at what they're doing. B, they have a really nice area to work with without your chin right here looking at them. And C, it helps the flow when they're going to flush this out, and we'll discuss that in a minute. It helps the flow to make sure that everything is going to get down to that artery where it needs to be. So you'll just turn your head, close your eyes, relax a little bit. They'll feel for those bumps on that port and know exactly where they need to access the port. Then I'm going to show right here what the needle looks like. So turn your eyes away. I won't wait. I'll give you a couple seconds here. Turn your eyes away if you don't want to see it. But this is what the needle will look like. And it doesn't go in sideways like an IV does. It goes straight in. They just push it straight into that port. Easy peasy lemon squeezy. Your skin is numbed. You don't even feel it. All you feel is the pressure of them pushing. No pain. Then what they'll do is once they have it accessed, they will use a syringe to try to pull some blood out, make sure that they have access where they need it to be, and then they will flush it with some saline solution. They will tape it all up and get you all set, cap off everything to the ends of all of the medical tubing to keep you safe from infection, and then you'll go get ready for your treatment. Now, here's the worst part about accessing a port. This is not a scary thing, but it's unpleasant, and I want to share this with you so you know. Once your port has been accessed and they flush it with the saline solution, I don't know why it is, but many people who have ports experience this. When they flush that saline solution, you taste it in the back of your throat. It's almost like a post-nasal, really weird salt water. I'm almost going to vomit thinking about it. It is a saltwater taste that goes in the back of your throat. It is very unpleasant. I don't know why it does it. I really don't know why it does it. So here's the trick. When you're going to go have your port accessed for treatment or any other thing, they are going to have to flush it. Make sure you carry some little peppermint candies with you. Pop a peppermint candy in your mouth right before you're going to have your port accessed. And as you're looking away this way and you're sucking on a peppermint candy, when they flush it, you're not even going to taste it. You might smell it. It has a strange salty smell, but you're not going to taste it. And trust me, you're going to want to have the peppermint candies. Now, what happens if you go up and you forget your peppermint candy? Ask the nurses. Chances are they probably have a little stash either stuck away, or sometimes they even have a little candy bowl right on the counter. Make sure you can get a peppermint candy to suck on. It will help. I even brought extra peppermint candies and I gave them to my cancer center so they would have them right there, so in case I forgot or in case somebody else forgot, they had peppermint candies available to them. So that is a big tip for those of you who will be having ports. Now, this is very, very important. Never, ever let anyone access your port unless they have been trained to do so. There are only specific nurses and doctors in the medical field that are trained to access ports. If you find yourself in the emergency room, or if you find yourself being admitted to the hospital, or if you find yourself going in for treatment, whatever it is, if someone comes to access your port, you ask them, are you qualified to access a port or a power port, depending on the one you have? You'll have a card that they'll give you when they put this in. You can keep that in your wallet or in your purse at all times in case they want to know what port you're dealing with. Have that, keep that handy. If they have not received the training, they are not to access that port. They call someone in. There's always going to be someone in the emergency department, on the floor, doesn't matter. Somebody is going to be qualified to access that port. Don't let anybody access it unless they're trained. It's very, very important. So that's probably the scariest thing about it, is just making sure this is protected. Again, this goes straight to your heart, all the way down to that artery. Protect it from infection. Also, make sure you check to make sure that your incision is healing well. If you have any signs of infection, follow up with your doctor. Also, if you find that when you're having your port accessed and they're having difficulty finding out whether they have good flow, whether it's a good poke, if they're not able to get blood out of it or get the saline back in, turn your head a little bit more. Just kind of turn. And just make sure that this little hose that will be in your neck is not kinked. You'll be good to go. Sometimes they have to take it out and start with another one. That's okay. You're not going to feel it. It's just a little bit of an inconvenience. So that's it about ports today. Until I see you again, take care of yourself. And thank you so much for joining me here on 1 in 75. Bye-bye.